raise the retirement age. President Obama's proposed that from 65 to 67. Again, that's nibbling around the edges because very quickly, in 2 years, you're going to be still with twice as many seniors on Medicare as you have today. So that's not going to help. So one of the other things that we absolutely need to do, and I don't think the Affordable Care Act, the Obamacare Act, is going to do, is decrease the overall cost of health care and the trajectory of increasing cost of the healthcare system in general. And that's a big part of the focus that we have to have, because the less expensive healthcare is, the less money Medicare at the time is going to have to pay out. So that's got to be part of the solution. How do you do that? Well, in my view, we need to do a lot of things. First of all, transparency in pricing. Healthcare, we need to all know what healthcare costs everybody. Anybody sitting in the hospital knows. I was a heart surgeon before. If you came to me and said, Larry, how much is it going to cost for my surgery? I couldn't tell you. I could tell you what my office bill would be, but I couldn't tell you anything about the hospital, what the hospital bill would be, or what the charges are. And the problem is it's a very complicated system, because depending on who you are, how sick you are, what other medical problems you have, what co-insurance you have, other things, nobody's the same. So the transparency is something we need to address, but it's not simple. The other thing is, in my view, we need insurance, to drive down the cost of healthcare in general. We need to open up the insurance market. Insurance companies need to compete on a nationwide basis for healthcare, because competition drives down the cost of healthcare. The other thing we need to do is allow businesses, small businesses and others, to pool their number of employees. Say, plastics industry, pool all the plastics workers in the United States and in an organization together and say, okay, insurance companies, what can you do for us? And you will drive down the cost, how much it's going to cost people for health care. We need to expand health savings accounts. And one of the other big factors as a doctor, I tell you, is we do have to have people take more personal responsibility for their own actions and how they decide that they're going to take care of their own health. And we have a big problem with that in our country in all age groups. People, if you want the cost of health care to come down, people are, personal responsibility is one good way to do that, because right now, for example, compliance level on medications at all age groups is maybe half of people take their medicines properly as prescribed by other doctors. A large percentage of the population don't go get physicals, so they don't know what health ailments they have, and that's young and old to do that. So we need to do a lot of those things.
Stop abusing. Stop abusing.
Yeah. We need to take some more personal responsibility for our own act. Our country does. Now, I'm not saying you or you, but as a whole, our society needs to recognize that if we're going to drive down healthcare costs, we all have to be conscious about it. That's one thing. So we have to change the cost curve of healthcare and drive it down if we're going to control Medicare expenses. And the other thing, I honestly believe we're going to have to restructure the program, and it's going to have to be different for people like me than it is for you. Because if you look at the trajectory of spending and double the number of people on the Medicare program in 2030, there's no one that could look at that and say there is a way to make that work without changing it. And that's controversial. As you know, you probably know it's a controversial proposition to change it, to basically get the government out of the healthcare business and get the government in the business of having Medicare patients compete for private health insurance, and then the government paying the premiums on their behalf. And honestly, people in high income like myself, who's a heart surgeon, are going to have to pay more for our Medicare in the future than someone who is low income. If we're going to say that if the system's going to be in place, it's going to have to be means tested in the future. People that are low income are going to pay nothing. People that are Warren Buffett, they're going to have to if they want to be on their Medicare, they're going to have to pay more for their premium if Medicare is going to be successful. And so those are the ideas that are out there. And they're all controversial. They're all difficult. But like I said at the beginning, the option of doing nothing, saying we're not, some people are saying that we're not doing anything about this because this is a program. The program will not be in place. It's not going to, by 2024, without some changes. And in 2024, current seniors at that time will have huge cuts in their Medicare if we don't do anything. That's not an acceptable situation because and it becomes an access problem. It'll become an access problem just like the Medicaid program is. If you know anybody that's on Medicaid, they have Medicaid, but in a lot of communities, they have a hard time finding doctors that will see them or take care of them. That will happen with Medicare also. It's already happening. The AMA says that 1 in 3 doctors, primary care doctors in the country, are limiting the number of new Medicare patients that they're taking today for financial reasons because Medicare doesn't cover the costs. 1 in 8 physicians in the U.S., and this is AMA data if anyone wants to look it up, 1 in 8 physicians is not taking any new Medicare patients at all. So there's some closed practices where they have Medicare patients, but they're not taking anybody new. That's a big problem since 10,000 people a day are retiring and going on Medicare. And that's where we are.